This is Dr. Roger Knapp, pediatrician. I want to talk to you about pink eye or eye infections we call conjunctivitis. The newborns can have a clogged tear duct, and the matting up and a little bit of mucus is caused from a tear duct blockage and not really a primary infection. And sometimes we'll give some antibiotics to clear out any secondary infection, but it's a clogged tear duct, and you can see my discussion about that on another video. The older infants, typically 1 to 2, 3 years of age, when they get a sinus infection, it starts off as a clear runny nose, then it turns into yellow and green, and that's because there's a higher number in the bacteria in the mucus. And it doesn't necessarily mean it's in their body, and we don't want to overdo antibiotics, but it does mean they're prone to getting an ear infection. But if your child is acting normal, and they just have the green goopy nose, then that's not a call for antibiotics. The tear duct, though, drains tears out of the eye into the nose, and that tear duct can get infected from the bacteria and the mucus in the nose. So it backs up that tear duct into the eye, and you can have a little bit of green stuff in the eyes, but the white of the eye is fairly normal looking, and the eye is not swollen, and it's really a sinus infection backing up into the eye in what grandmas call cold in your eye. And the antibiotic eye drops might help that a little bit, but you didn't treat the primary cause, which is the sinuses. If it does back up into the eyes, generally the baby's going to be fussy because it's really now a sinus infection, and 50% of those children will have an ear infection with it. So it's important to see your pediatrician and have the ears examined and not just call for some antibiotic eye drops, because that's really not pink eye when they have a green goopy nose. It's really a sinus infection. School-age kids, they don't get that, but they do get pink eye or eye infections. And there you need to, of course, call your pediatrician for some antibiotic drops. They're generally going to be bright red from across the room, and a fair amount of mucus drainage from the eye 3 or 4 times a day. Just be careful that you're using proper techniques with your contact lenses as teenagers, because if you're using your saliva spit to moisten contacts and put them in your eyes, you're putting bacteria in there, and you can have some rip-roaring eye infections from poor hygiene of the contacts. So use proper care when you're using contact lenses. That's the gist of pink eye or eye infections. Thank you. This is Dr. Roger Knapp.